Welcome to the Growth Mode podcast, where real conversations fuel real business growth. Hosted by Nina Labbe, media strategist with Salem Surround. Get ready to listen, learn, and grow. This is Growth Mode.
What happens when navigating the healthcare system becomes overwhelming and you need someone in your corner? That's where today's guest comes in. I'm Nina Labbe, media strategist with Salem Surround and host of the Growth Mode podcast, where we spotlight business leaders making a difference and dive into their growth strategies. Today, I'm joined by Laura Daniels, founder of Care Advocates, a nurse-led advocacy service that empowers patients and families through one of life's most vulnerable times. Get ready to hear how she's turning compassion into a powerful business and what we can all learn from her approach. Laura, thank you.
Thank you, Nina, for having me here. Good morning.
Yes, thank you so much for being on the Growth Mode podcast. I'm excited to have you on. Let's get into it. I always want to know the story behind the business and your journey. What inspired you to create Care Advocates?
Absolutely. I've been a registered nurse for over 33 years in the geriatric space, working with older adults. And about 8 years ago, I had a friend, Judith, who lived right in front of me, and her family was in Washington, and she kept having falls. And after the third, fourth fall, we ended up in the emergency room. Went back home. She fell again. She went back into the emergency room, and she was hospitalized. So she came out of the hospital, and that experience was so overwhelming for her and for myself, even though being a registered nurse, all the information that they were providing to her and myself was very confusing. Like, where do you go after a hospital? Do you do an acute inpatient rehab? Do you go into a skilled nursing facility? We were given a list of options of all of these rehabs, and it was very confusing as to which one to choose. So we go into skilled nursing facility, later finding out that an acute inpatient rehab would have been better because she was a very young 70-year-old.
Oh, wow.
After that, she wasn't able to go back home. So now I am helping her find assisted living. That was so confusing with all of the choices in San Antonio. We have over 300 different care options to look at and choose from. Both they encompass independent living, assisted living, memory care, residential care homes, just so confusing. So we're going and looking at these places, and we're looking at assisted living communities, and that was overwhelming in itself, just seeing what the room cost was. And then there are levels of care, and then there's add-ons for medication administration. And
overwhelming just to make a decision.
Absolutely. So we finally, we picked an assisted living community for her after looking at about 4 or 5. And she lived there happily for the next year and a half, and then she passed. But that experience of Judith inspired me to start my own business and advocating for others, assisting them with all of the care transitions, because it is such an overwhelming time. And I thought, okay, I'm a nurse, I should know all this. But no, I mean, figuring out what is acute inpatient rehab versus long-term versus skilled nursing, and then in-home care. What does she qualify under her Medicare benefit? Can she get care at home? How much is covered? What about physical therapy? So all of those questions were so overwhelming that she inspired me to start my own business and advocate and guide and educate others who are experiencing the same questions. And you know, when you are in a hospital and you don't know what the next steps are, and you do not know what you are entitled to under your Medicare benefit, and also with assisted living options.
And it sounds like that was your defining moment that made you realize that patients and families, needed that kind of guidance.
Absolutely. It's very confusing if that is not your background. It was my background, but even at that, I didn't understand what all the options were.
Yeah, for someone that's unfamiliar with what an advocate does, like what would you describe the mission of your business?
Absolutely. So our mission is to empower families with information, education, and advocacy. So we guide, educate, and we assist them with all the options in care transitions. Whether you are in the hospital and you do not know where to go next, what are you entitled to under your Medicare benefit? Acute inpatient rehab, skilled nursing facility, what happens after hospitalization? What are the options that are out there? So our mission is to guide, advocate, and educate every client that we serve for a lifetime. Our advocacy and education support is at no cost to those families that we serve.
I love that. Let's talk a little bit about the industry landscape. What are some of the biggest challenges that you see patients and families facing today's healthcare system?
I think the biggest challenges that we are facing, and there are many, but the biggest challenge is lack of information, lack of education, lack of support. The case managers at hospitals and skilled nursing facilities are just overwhelmed. They're overwhelmed with all the patients that they have to care for. So when someone is discharging from a hospital setting or a rehab setting, just not having all the information and all of the available resources that they are entitled to under their benefit. There are so many resources out there that under your Medicare benefit you are entitled to without paying. So just that's the challenge, accessing the care, knowing the information, knowing what is available out there for yourself, for your loved one, for your spouse, for your mother or father.
And I bet you a lot of people don't even know that they have those benefits.
Absolutely. Yeah, my background before starting my business was Medicare. So I worked for Medicare. So that was also another inspiration, is knowing what a member is entitled to under their benefit, right? So I took all of that knowledge and Judith's inspiration, that confusing time of not knowing where to go next, and I'm bringing all that experience with me. So I know what you are entitled to under your Medicare benefit, and that's something that we also educate families on. Have you asked for this? What about that? You can get a visiting physician at home. What about podiatry? What about? There's just so much information and access to care out there that people are not aware of.
Right. And it's so important to have all that education so you can make a fully informed decision.
Absolutely.
So what about the demand for patient advocacy? How has it changed over the years?
So when you are in a crisis in a hospital after a stroke, it's you don't know where to go next. So it's important to have the information. So advocacy is important. I always tell families, utilize the resources in the hospital. Ask your social worker, your case manager. But when you are not able to get all of the information or support, we are here to support you as well. So.
Wonderful, wonderful. What about trends? Trends that you're seeing in the healthcare space that business owners or even everyday consumers should be aware of?
Right. I think one of the biggest trends is we have 11,000 seniors turning 65 every single day. So the need for more long-term care placement, that is becoming more and more of a need. We're seeing a lot of assisted living communities being built. That's one trend. Another trend is just accessing healthcare. A lot of this is being done digital now. You see virtual medicine, telemedicine. So those are a lot of big trends coming up. A lot of patient monitoring at home as well to monitor vital signs. A lot of those are good, and some of those, as people are older, they don't want to. And going back to what resources are out there, you can get care at home. You can have a nurse practitioner see you at home, covered under your Medicare benefits. So a lot of trends, a lot of AI coming in, a lot of new technology coming in that is replacing that face-to-face, interaction. But there are ways around it also if you understand your Medicare benefit. But one of the biggest trends is people are needing somewhere to go if they're not able to care for themselves anymore. So that's where we come in with placement. We have over 300 options in San Antonio that consist of assisted living, independent living communities, assisted living communities, memory care, residential care homes. So just because you've had a stroke and you can't care for your loved one, nursing home is not the only option. There are other great options out there that are less expensive, and some of them are covered and some of them are not. But that's how where we guide you is to help you access good care, and we educate you on cost, on what is covered and what is not. So that's the trend, is that there are better care options out there than just a nursing home setting.
Sure. Yeah. And I'm all, for new technologies and everything. But one of the things that has actually, I feel they need to come up with a better idea is with your elder seniors. I mean, like my parents, they're in their 90s. They don't like seeing their doctor on a screen.
Absolutely. Really everyone wants that personal connection, right?
Yes. And they want them to sign up on the portal.
Absolutely.
And they can't do that.
As you know, with elder population, you've got to speak slowly. You have to be patient. So it's very hard to do it over a screen or over a digital device that's in your home. So that face-to-face interaction is important.
Yes. And so, obviously, since they can't do the portal, I have to do the portal.
Yes.
Yeah, so it gets a little complicated sometimes, with communication and all that. But, we get through it as best we can. All right, so let's talk about your approach and your impact. What sets care advocates apart from the other services that are out there?
We have a lot of great services in San Antonio, but specifically with care advocates, we are registered nurses, certified dementia practitioners. We educate, advocate, guide everyone through all the transitions of care. Our commitment and our service, support, and guidance is for a lifetime. So that's kind of what sets us apart. We are also available 24 hours a day, 7 days a week. We work all day long. When you are in a crisis and your spouse or your mother has a stroke, or you have a question, that is not a 9 to 5 question, right? You have to be available for your families all day, every day.
Right.
So I think that's one of the biggest things, is that we are there to support them through every transition, every question that our families have. If you have no income, we will guide, support, advocate, and give you all of the resources that you need to access good care. Whether you cannot afford assisted living or memory care, we will give you all of the information and tools to help you make a good decision.
Yeah, what a valuable service. Can you share a story? You don't have to mention any names, where you saw your work, make a real difference in someone's life. Obviously, we heard about Judith.
Right.
Any other stories that you can share?
Oh, there are so many. I think I can think of two. Every day is a different story, but I'll give you my latest story. This week, I got a referral from a neurologist. He is 58, and his wife has dementia. She is 57.
Wow.
She was diagnosed at the age of 49. I met them in their home, and he's 58. He looks like he's 75, just so overwhelmed. And his wife is beautiful. I mean, she looks like you, beautiful, tiny, and she only speaks in one word. Her dementia is very far advanced. And he's just overwhelmed. The guilt of him placing her overwhelms him, but he can't take care of her. I mean, she's up at night. She is sundowning. She has a little bit of behaviors. At night, she follows him everywhere. She needs assistance to go to the bathroom and to shower and to dress. And he is taking care of her 24 hours a day. And he's just broken. And he told me, he goes, Laura, I have no one. It's just me and the dog. And, and I have to take care of my wife. And I don't want to place her, but I can't take care of her anymore.
Yeah.
So just being in their home and seeing all of their beautiful life story. They had only been married for 20 years. They've only been married for 20 years.
Yeah.
And how she has declined, and they live in a beautiful neighborhood. And she was the life of the neighborhood, having all of the neighborhood block parties and the holiday dinners, and the neighbors come and they pick her up every day. There's about 4 ladies that pick her up. They take her to dinner. They take her for walks in the morning. So very strong support. But at the end of the day, he's alone with her. Right. So we talked about memory care. We went and looked at a couple of care options. We toured, and the caregiver ages 5 times faster than the actual patient, the actual dementia patient that they're taking care of. Yeah. So finally we toured. He was just crying and broken through every tour. So when we help families access care based on budget, location, care needs, the unique situation, in this case, we're helping place a client who has dementia. So we look at what are the care needs for his wife? Yeah. How much care does she need? We looked at his budget and we looked at the location. Based on that, I presented him with 5 options. We went and looked at 3 of these options. So we toured, and he was in tears through every one. And he finally, he picked a place. He chose a beautiful place for her. Yeah. It is a 16-bed memory care community about 1.5 miles away from his home. And he placed her yesterday. So completely broken. We connected him with a support group for men. And young men, and he's going to start that next week. But his fear is she going to be afraid? Is she going to miss me? Is just all of these questions. And what I said to him is, placing her is going to be harder on you than it is on her. She will be okay. Yeah. It's going to take a few weeks for her to transition. Right. But it's going to be harder on you, but know that she will be fine. So, and the places that we tour and we place, we vet them out. We know the owners, we know the staffing ratio, we know the care. So we're only touring places that we at Care Advocates trust. So, so just, just giving them that permission that it's okay, that placing your wife is an act of love. Right.
And I can see how that builds trust with clients.
Absolutely.
What about building trust with medical professionals like the neurologist that you were talking about?
Right. So just, we build trust with our medical professionals and our referral sources in the industry, because they understand, they know that we have the background, right? I have the nursing background. When I place someone, I'm going to that hospital or that community. I'm seeing what can that client do? What can that client that, we're placing your mom. Is your mom a 2-person transfer? Is your mom, does she need a Hoyer lift? Does she need, what assistance does she need? Are there any behaviors? So we bring all of our background and all of our experience, and we can, by assessing that patient at bedside, we know where that patient belongs based on the care needs, the budget, the location. We communicate with all of our referral sources to let them know, okay, we've placed his wife. She's going into a wonderful 16-bed memory care. We've connected the husband with a good support group. Yeah. So he can grieve and get through this difficult transition for him. So I think just the way that we build trust is through communication. The families that we serve go back to our referral sources, like the neurologist, and they're able to talk about, Laura's helping me through this. We're touring this week, and later he'll go back and he'll talk about his experience and how his wife is in a good place. So
I love that communication and sharing it with, the neurologist and your other medical professionals, because they know what's happening step by step, where they're at, how the spouse feels.
Right. And I can give you another story that has something to do with dementia. So a couple of years ago, we placed this lady, we'll call her Sally. And Sally, I got this referral through an attorney. They were working on her estate, and she was living alone in a little apartment. And I walked into her apartment, and it was filled with hats. I mean, just like 50 hats. Yeah. And Sally went nowhere. Yeah. Okay, she never went out. And since her husband died, she was home for 4 years. So she would just have a friend who would come over to drop off food. So the attorney's office, wanted her placed because they felt that she was not safe at home. She could still do a lot of her own. Yeah. She was walking with a cane, but she was very isolated from from everyone. She's been in her apartment for 4 years.
Yeah.
So I went to meet her. I asked her what her preferences were, what she liked, and then picked her up, and we went to look at a couple of independent living communities. She was still very independent.
Yeah.
So knowing that her balance was starting to be a little bit off, we looked for a continuum of care community, meaning we're going into independent living,
Yes.
but as soon as Sally needs assistance, we can transition right next door a few steps into assisted living. So we went and we looked at the first place, and we very, very shy, cute little lady with a cane and her big hat. And she walked in and she looked at the piano and for a couple of minutes. And then we looked at the community. We toured at the first one, and she's like, "Oh my God, all this is for me." I said, "Yes, you have access to the little theater, to the dining room, to the courtyard." She had just never seen this world.
Wow.
Right?
They make it fun.
Absolutely. It's like living in a little resort. So then we go and look at the second community. We walk in and she looks at the piano, and I'm like, why is she staring at the piano? And then we went to the courtyard and looked at all the amenities, because when you move into independent living and assisted living, you have access to everything, right? From their little bistro to courtyard to if there's a pool.
Yeah.
So she couldn't believe, she's like, and all this is for me. I said, Sally, you have access to everything. And we're always, the sales director's there, and they do a beautiful job of touring and showing them the room and the amenities. And so we go to the third place, and she walks in and she's looking at the piano, and the sales director says, "Do you play the piano, Sally?" And she said, "Yeah, I actually do." And very, very shy, very timid. So she sits in the piano and she starts playing the piano. And then all of a sudden you see her like sit up and start playing, and it's just the most beautiful moment. You saw that confidence, just her confidence come back, and she was playing beautifully, and all of these residents started to come out of their room, like the people in the kitchen, the caregivers, the residents, and then they just all started applauded her. And it's just a beautiful, beautiful story. And we placed her, and now she's thriving and doing well, and she has purpose. She's plays the piano for others, and she has a sense of community, a sense of fellowship that she didn't have because she was so isolated. So placing your loved one is not a bad thing. You give them a sense of community, a sense of fellowship, whether they're alert like Sally, right? Or whether it's somebody with dementia, because because you have dementia, and have can't verbalize anything. Just knowing that you are around other people is
and that's
beautiful.
so heart-tugging too. And it's amazing what music can do too.
Absolutely.
Yeah.
Yes.
So let's talk about your vision. Let's talk about growth and what strategies that have worked well for you in building awareness around your brand.
Yeah. So my vision is to empower families and clients with all the information for them to access care. We give everyone education information just to let them know about all of the resources that are out there. There's a lot of resources if you're a veteran that families are not aware of. They're like, well, nobody told me that. I was like, well, they don't really advertise it. So we just empower people with information. I always ask everyone, I give them my little book, like, share this. There's a lot of resources and information out there that people need to know, whether you have no money or you can afford to move into memory care or assisted living. So our mission, my vision is to just that people are informed of all of the resources out there, that there is good access to care if you ask the right questions.
Right.
Always be an advocate for your loved one in the hospital. So I empower I empower families with questions to ask when you're in a hospital setting.
Right.
Because it is a very overwhelming time, and you just think because they give you what they give you, and that's all you're entitled to. You are entitled to so much more.
Yes,
right. So
absolutely.
just that my mission is to continue to educate people, to bring awareness to our community.
Right. And that's it. Education. I mean, everything that you have said has been so educating, even for me.
Yes.
I think that more people need to learn about you.
Right. And, not just with senior care and placement, right, but also with seniors who are in their home, right, accessing, we have wonderful transportation services out there for them. We have our senior community centers. There are people around the world that come to San Antonio to learn how the city of San Antonio runs their senior centers. There's so much money put into, I think we have over 14 senior centers in San Antonio.
Right.
And all of the access, all of the resources that are in senior centers at no cost for those that are over 65.
Right.
So all of that, we give them that information.
Awesome. So what's next? What's next for Care Advocates? Are there plans to expand, evolve, grow?
Well, my focus is San Antonio, right? We do service areas in Dallas and Austin, but the focus is in San Antonio. I'm also Elder Care Commissioner for the city of San Antonio. So with that, our focus is to really bring more transportation and more wellness and access to care to our local seniors, and really to empower everyone to know all of the resources that are available at no cost, especially if you're living at home, all of the wonderful resources that your mother or father or that yourself as a senior has available to you within the city of San Antonio.
Right. Okay. All right. So if people want to reach you, what's the best way for someone to contact you?
Oh, you can call me.
Okay. What's that number?
210-669-2222. You can go to my website, advocatern.com. And we are available every day, holiday weekends. We know that if you have a question about yourself or your mom, we are here to answer that and walk you through what all the care options are, what all the resources are, and just kind of walk you through your question or your crisis or your issues.
And I can tell you have your heart and soul in this,
Absolutely.
Laura. I can totally tell. This was such an inspiring conversation with Laura Daniels. Proof that heart and strategy can absolutely go hand in hand. I hope her story gave you new ideas for how to grow your own business with purpose. If you're a business owner looking to attract more of the right customers, I'd love to help you build a marketing strategy that works. Right now, I'm offering a special growth mode package that includes full organic SEO for $3,100 a month for a minimum of 6 months. Plus, get this, 3 months of free radio advertising to help kickstart your visibility. It's designed to get you found and get you heard. So get all the details. You can email me at growthmode@salemsurround.com, or you can call me at 210-526-3626 to learn more. I'm Nina Labbe. Thank you so much for joining Laura Daniels and I on Growth Mode. And we will see you next time.
Thank you, Nina, for having me.
Bye-bye.
Thanks for listening to the Growth Mode podcast with Nina Labbe. Stay connected, keep learning, and keep growing. Don't forget to like, subscribe, and share. And we'll see you next time on Growth Mode.
Want to grow your business online and on the air? Right now, when you sign up for a 6-month organic SEO campaign at $3,100 a month, we'll include a free radio schedule, 1 week per month for 6 months to help kickstart your visibility. That's a $5,000 value in radio advertising, designed to drive awareness and leads from day one. Don't miss it. Email Nina Labbe at growthmode@salemsurround.com or call 210-526-3626 to learn more.